When Daniel Posto, a second-year medical student in Manhattan, opened the App Store on his iPhone a couple of weeks ago, he was astonished to see an app for a new heart study prominently featured. People often learn about new research studies through in-person conversations with their doctors. But not only did this study, run by Stanford University, use a smartphone to recruit consumers, it was financed by Apple. And it involved using an app on the Apple Watch to try to identify irregular heart rhythms. Intrigued, Mr. Posto, who already owned an Apple Watch, registered for the heart study right away. Then he took to Twitter to encourage others to do likewise, suggesting that it was part of a breakthrough in healthcare. It's not inconceivable, by the time I graduate from medical school, Mr. Posto said, that the entire practice of medicine can be revolutionized by technology. Apple, Google, Microsoft and other tech giants have transformed the way billions of us communicate, shop, socialize and work. Now, as consumers, medical centers and insurers increasingly embrace health tracking apps, tech companies want a bigger share of the more than $3 trillion spent annually on healthcare in the United States, too. The Apple Heart Study reflects that intensified effort. The companies are accelerating their efforts to remake healthcare by developing or collaborating on new tools for consumers, patients, doctors, insurers and medical researchers. And they are increasingly investing in health startups. In the first 11 months of this year, 10 of the largest tech companies in the United States were involved in healthcare equity deals worth $2.7 billion, up from just $277 million for all of 2012, according to data from CB Insights, a research firm that tracks venture capital and startups. Each tech company is taking its own approach, betting that its core business strengths could ultimately improve people's health, or at least make healthcare more efficient. Apple, for example, has focused on its consumer products, Microsoft on online storage and analytics services, and Alphabet, Google's parent company, on data. The big picture reason that a lot of these tech companies are getting into healthcare now is because the market is too big, too important and much too personal to their users for them to ignore, said John Prendergast, Associate Director of Healthcare Investment at Ben Franklin Technology Partners, a non-profit organization in Philadelphia. Physicians and researchers caution that it is too soon to tell whether novel continuous monitoring tools, like apps for watches and smartphones, will help reduce disease and prolong lives, or just send more people to doctors for unnecessary tests. There's no shortage of hype, said Schreier. Eric Topol, a digital medicine expert who directs the Scripps Translational Science Institute in San Diego. We are in the early stages of learning these tools. Who do they help? Who do they not help? Who do they provide just angst, anxiety, false positives? The tech industry is certainly no stranger to health.